Is your DNA causing your hair loss? How does your family genetics affect your hair loss and your thyroid? Today, we'll explore options to help you get to the bottom of this question. Hello, thank you for listening to Thyroid Hair Loss Connection podcast, a science-based, honest, candid conversation about how your thyroid affects your hair. You will learn practical solutions to hair growth, healing your thyroid, and balancing hormones with holistic nutrition approach and the latest treatments. Your hosts, me, Nataliia Sanzo, a registered dietitian, aka Nashville thyroid expert, and Kimberly Vaughn, a board-certified trichologist, hair loss specialist, and coach. To stay up to date on the latest topics, make sure to subscribe to our channel. We also cannot do this without you. Send us the question to the link below and tune in each week for the answers. Now, let's head to the show.
Genetic hair loss is a common hair loss type inherited from one of our parents whose genes carry a specific genetic code responsible for this baldness. Over the years, we've discussed and research has predicted that our genetic hair loss comes from our mother's side of the family, or maybe even both sides of the family, right?
Yes, Kimberly, it's just like Hashimoto's. It's thought to result from a combination of genetic and environmental factors.
Oh, right. Oh, I know. And so just so you all humor me, I'm going to ask Nataliia and Sutton and myself, and we're going to take a little poll and let you, listener, know what's going on with our family and hair loss in our family so that maybe it gives you a good comparison of as you listen and think about this. So Sutton, our amazing, handsome producer at the age of 26, with a really nice head of hair, we're going to pull you into this. Tell us about your parents. Do either one of them have thinning hair? And then add in about your siblings.
Yeah, I would say that my father has had thinning hair. He's got a bald head now. It's probably been ever since I've been alive. So it came on pretty early. My mother, I'm not sure. She hasn't ever mentioned anything to me, so I can't really say for sure. But my younger brother, who is now 23, he is receding a little bit more than me. So I'm looking at him and seeing my future.
In the reverse order, right?
Yes, I guess.
I know. And Sutton has a nice full head of hair. However, even at 26, his temples are starting to slightly recede. And he has mentioned a couple of times during all of our podcasting that maybe, it would be helpful to kind of think of something as a proactive treatment.
Yeah.
Nataliia, on to you. So tell us about your mother and father and of their hair loss and your brother.
So fortunately, I don't have any genetic hair loss in my family. There are, of course, some thinning of the hair in my mother and grandmother as they get older, but none of them that I know of that have alopecia areata or anything genetic-wise. Now, I do know that my hair loss that I experienced last year, and that's how I found you, right? Your hair loss clinic is my hair loss came from my Hashimoto's with COVID.
Mm-hmm.
When those two things happen at the same time. So diagnosis of Hashimoto's, then getting sick with COVID. So that's the only time I remember that I had any kind of problems with my hair loss.
Okay. So mine is a little combination of the two. So my father had very, very fine, thin hair. And when he passed in his late 70s, he really had no balding. It was just finer and thinner. My mother, on the other hand, also has Hashimoto's, just as my grandmother did. And so she battles off and on, depending upon how her levels are in her Hashimoto's. And because she's getting a little older and because she's petite, her hair ebbs and flows, right? Sometimes it's a little thinner. Sometimes she'll call and say, oh, I'm having a great hair day. Oh, what should I do? I'm starting to thin a little, right? So I think after listening to us, listeners, you now can see just between the three of us, it's very different and it's varying. So if you're like us and the billions of Americans and want to learn more and get to the root of the hair loss to learn, is this really genetic? And if it is, what can you do? You're in luck. We have a brand new test. And it's now called the Tricho test. It's based on pharmacogenomics to help us understand if our DNA is causing our hair loss and what treatments can be effective to help combat this hair loss and thinning hair. Let me first begin by explaining exactly what pharmacogenomics is. So pharmacogenomics is the field of precision medicine, which aims to tailor medical treatment to each individual person. Love it. It's right up my alley, right? And Natalia's. So I was really excited when we started being able to offer this test. The pharmacogenetics testing also looks at how your DNA affects the way we respond to drugs or treatments. In some cases, your DNA can affect whether you have a bad reaction to a drug or whether a drug actually helps you or has no effect at all. Nataliia, let's take the classic example, right? I think we can all appreciate the times that we have been given antibiotics. And usually those courses of antibiotics are for 5 or 7 days. At the end of that, the provider always says, oh yes, this will continue to work for 2, 3, 4, however many more days after. But some of us, i.e. me included, get sick all over again. So evidently, if my DNA would have been tested before, then we would have known exactly which antibiotic to give me, because when I went back and the first antibiotic didn't work, then they changed the antibiotic, right? So I think we're really on to something, and I'm real excited about all of these new testing opportunities. Precision medicine, with the help of pharmacogenomics, can improve your health by helping you know ahead of time whether a drug, just like the example, right, of the antibiotic, will benefit you. Let's take one very important example in the world of breast cancer. Some breast cancers make too much HER2 or HER2. This is a receptor. And if any of you that are listening have ever been tested for this, you totally know what I'm talking about. And this extra HER2 helps the cancer develop and spread. There is a drug, TDM1. This particular drug can be used to treat this type of breast cancer and works by attaching to the HER2 on the cancerous cells and killing them. If your breast cancer is tested as HER2 positive, then certainly we want to make sure that if you're under oncology treatment, that the drug TDM1 is going to be used for your treatment. If, however, the tumor does not have enough HER2, so it's considered HER2 negative, TDM1 will not work for you. So it would be a waste of time and a waste of treatment. And sadly, your cancer could continue to progress. So that is just simply one example that we talk about from CDC, offering just exactly what pharmacogenomics can actually be used for going forward in the world of medicine. Now, let's move back to our Tricho test. The test analyzes genetic factors and others that are relevant to patient characteristics to determine what kind of therapies and treatments might work best for an individual's hair loss based on their unique DNA. A Tricho test is fast. It's easy. It's 100% non-invasive. It's one of the best tools available to help us treat your particular personalized hair loss with a precision recommendation of a treatment protocol. So now, Nataliia, everybody can be a candidate for the Tricho test. So just so our listeners know, who should use the tricho test, right? Anyone who wants to understand how their genetics affect their hair loss treatments, or how is the genetic pool predetermined and going to affect the outcome of treatment. Anyone with a family history of hair loss, men and women who have either tried numerous solutions with no or little success, and last category that's important, men and women who are just beginning to experience thinning hair in the temples or the crown or the top. So all of these individuals can be great candidates for this test. Now, where can you find the test? You can find the test online on our store. You can also go to the HPI website, and under our services tab, you'll see a drop down that says hair test. There's actually a real test there. It is from one of our staff members who has genetic hair loss, as well as Hashimoto's and thyroid and several other issues causing her hair loss. But it was my intent to make sure that we had a real test that was available for your viewing. So don't hesitate to go take a look at the test. It will give you exactly what the report looks like and what you can expect. The next, after you've ordered the test, you can collect the DNA sample from the privacy of your home. This is a gentle cheek swab. The process only takes about a minute. You'll fill out a questionnaire. All the instructions are there. You'll mail your DNA sample and the questionnaire. The results will be delivered in 12 to 15 days after the sample has been received for processing. Lastly, your results will be shared with your provider, i.e. HPI if you order it from us. There are other providers around the United States that also offer this test. A member of our team will contact you to schedule a 45-minute review and follow-up analysis, and that will be with one of our clinical trichologists. During that meeting or session, we will actually provide the report to you. So it's your full report. We'll also go through each page and explain to you where the genetics is coming from. Did this genetic come from one parent, both parents? Are you susceptible to X treatment or Y treatment? Oral medications, topical treatments, and supplementation that align and complement your body, and all supplementation, which there are very few on this particular report, will be listed there. And then it's your choice, right? At that time, you can make a conscious, educated decision on which medication you would like to move forward with. Is it oral? Is it topical? Furthermore, you could decide you don't want to move forward with any synthetic treatment and you just want to choose natural treatments. It's going to be your choice. It's that simple.
Kimberly, thank you so much for sharing with us and our listeners the innovative tests and shedding the light on this, on the importance of checking your DNA to make sure that you know exactly the root cause of your hair loss. Because if you know your history, you know your future, right? So thank you so much. I think it was very informative episodes. And guys, if you learned anything new today, please consider leaving a review on this show so we can continue doing these episodes for you. And again, thank you so much for being a part of Thyroid Hair Loss Connection community, and have a fantastic day.
Bye-bye.